Okay, before I even get into the video, I want to explain this situation right here. My hair is naturally dark. I was born a brunette. Well, no, I wasn't. I had light hair when I was little, but as I got older, it got dark. Anyways, the highlights, they looked rough. They looked like crap. You probably couldn't notice it on the camera, but they did, like, in person, and I did not like them. So I dyed my hair back dark brown, and I don't like it because, like, it wasn't supposed to be dark brown. It was supposed to be light brown. That's what the box said, but you can never believe the box. So save yourself the money in the long run and just go to a professional. Anyways, with that being said, here's what I want to talk about. My videos are about my experience, and from my experience, I had tooth decay. I had really bad tooth decay. All of my teeth were visibly, noticeably rotten. That's how I ended up losing my teeth. But there is another group of people who lose their teeth who do not have visible decay, and those people have gum disease. I'm doing this because somebody commented on a video that they weren't really totally accepting it because it was really shocking for them. Like, this is from what I see online. It's shocking for somebody to go from having what appears to be pretty decent teeth, sometimes very, very nice looking teeth, and then they're told that there is no saving those nice looking teeth and that they have to go. That is a lot more shocking, because there's, like, really no adjustment period. For the people who try to catch it in time, I believe they have to go, and get extensive treatment done on their gums to get them back up to health in order to be able to support the teeth. So basically what it is it's there's different types of gum disease, and, like, what it starts out is gingivitis, and I had that. I believe I had that from the time I was a kid, and that's why it was hard for me to brush my teeth, because when you have gingivitis, your gums are red and swollen and inflamed, and sometimes, like, they'll bleed when you brush. Sometimes there's no discomfort at all. So it's hard to really know that something's going on unless you're going to the dentist regularly. Gingivitis, if it's not treated, it can lead to periodontitis, and that is a more aggressive form of gum disease. And what happens is all of that plaque on your teeth, it'll start to go below your gum line to where you can't even see it. That's why it's so important to get your regular cleanings at the dentist, because once this happens, it gets in there, and I'll just read what it says online. It says the toxins produced by the bacteria in the plaque irritate the gums. The toxins stimulate a chronic inflammatory response in which the body, in essence, turns on itself, and the tissues and bone that support the teeth are broken down and destroyed. The gums separate from the teeth, forming pockets, which are just little spaces between your teeth and your gums, and those pockets become infected. As the disease progresses, the pockets deepen and more gum tissue and bone are destroyed. Often, this destructive process has very mild symptoms. Eventually, teeth can become loose and may have to be removed. And there's different levels of that. There's aggressive periodontitis, chronic periodontitis, periodontitis as a manifestation of systemic disease, um, and then necrotizing, I don't know if I'm pronouncing that right, periodontal disease. So anyways, you can just go online and read up more information about gum disease, for any of you who would like to know a little bit more about it, or who are watching this and don't feel that you need dentures, or that you even have anything going on in your mouth. That's something that usually you're not experienced and, knowledgeable enough to know that there's even anything going on. Like, for instance, my dad, he's always had really nice looking teeth, but I've noticed in the past few years when he smiles, the teeth, you can see that they're getting longer, and more of the root of the tooth is being exposed because the gums are receding, and eventually, because of those pockets that are formed, there's nothing to support those teeth. So while, you know, just sitting here like this, they might have a very attractive smile, and everybody's unaware of what actually is taking place inside of their mouth, and they will loosen up, and people just start losing teeth that way. So here's my advice to people, you know, who are watching this, who are in this situation right now and have past that point of no return, and you know you need to lose your teeth. I can understand how shocking that would be, but you have to understand that this is, it's necessary to get them out, because eventually they're going to fall out anyways. And even if you can't see it, even if you can't feel it, there's most likely active infection going on in your mouth, and that will affect the rest of your body, the way the rest of your body operates. And to me, it would be a lot less painful to go in, get them all pulled out, and get the dentures up front and deal with it that way, than to spend the next, you know, 10 years of your life, or however long it takes for the process to really complete itself, and watch each tooth fall out one by one. That would be a lot more detrimental to your mental well-being than just going and biting the bullet and getting the dentures up front and handling it the best way you can. Because yeah, eventually, as it progresses, the teeth are not going to look that nice. It will be noticeable that the gums have pulled back, and, you know, roots of the teeth are exposed, and, you know, eating is going to become a lot more difficult, because, you know, as you're biting into something tough, you're sitting there thinking in your head, am I going to lose a tooth today? It just would not be a very happy journey for you anyways. So as good as they look and as good as they appear, you have to understand that they're not in good shape, as if they were all just visibly rotten. It's just not a healthy state in your mouth right now. So sometimes it's necessary, and you deal with it like everybody else does. And, you know, nobody likes the fact that they have to get dentures. You know, we all want natural, nice, healthy teeth, but, you know, if that's not what you've got, then you have to deal with it the best way you can, and make sure that your health comes first, you know, above appearance, you know, because if you look nice, you know, that's whatever. But if your body is unhealthy, then that's just not good. Health should come first. So understand that. And if anybody wants to share any more information about this, post it in the comment section. So take care.